this little hole here, just so that I can leave them on their oxygen as much as possible. For this sake, our patient's on room air. Then I want to make sure I have my kit. So if you have this kit, everything that you need is in here except for water. If you have the big kit, then usually you have everything. So I'm using this little small kit. I have my sterile suction catheter.
Does it have the sizes on there?
Yes, so this one here is a 14 French. So, sterile suction kit. It came with my gloves, which are now in here. So, try not to use your patient as a table if possible. And it's always possible. Then, put on your sterile gloves. And sterile gloves, you can only touch the inside of with your bare hand. Now this glove, I can touch wherever I want on this one because they're both sterile.
Has anyone heard of a lavage?
Now I can't touch the inside because my hand has made it not sterile. And we're good. I'm sterile. We're in business. So at this point, I'm on this side of the bed. I need to decide which hand is going to be dirty, which hand's going to be clean. For the sake of this, it would be a lot easier if this was my clean hand so I can suction, and this is my dirty hand next to the suction. So I have my suction set up. I know my pressure is right. This is where I would ask you for pressures. I'm going to take my clean suction catheter. Both my hands are still clean at this time. And I like to do a little wrap method. And now I have this and this. So now I'm dirty here. So dirty, clean, and this is how we're going to suction. Check it, make sure we're suctioning, we're good to go. So I look, patient's stable, but I know that he needs to be suctioned because I can see secretions coming out. The second that I go here, my time starts. I find 12 on my catheter, and I go down. Thank you. Now here, you don't suction on your way down, you only suction once you're there and on the way out. So I suction, I feel some good stuff here, might leave it for a second, then I pull out. I like to turn. You do not have to turn if you don't want to turn. I give him a second. He desatted a little bit down to like 80. I came unplugged.
Connection right here allows me to instill normal.
He put his oxygen back on.
So I'm gonna hold it upright. I'm gonna put my saline bullet here.
All right, he's back up to 100. I feel his chest,
or however much you feel.
and he's still crackly as I'll get out. So we're gonna go one more time, sir. Boom, boom, boom.
And all I've done is I've added moisture.
I'm hitting resistance, so I'm not forcing it.
Which may rehydrate, could break down.
There we go.
All those dry secretions that are in there.
12,
and now I may be
suction.
able to suction them out.
Pull out.
We just don't do it very often.
So we may ask you that as well as like she mentioned the depth in regards to like the centimeters for like the Shiley and the XLT for suctioning. Like what are other ways to know whether or not you should withdraw? So if your patient starts like coughing or like sometimes depending on if you have like an awake alert patient with the trach, they will literally just be like this because they're so uncomfortable, or if you feel an obstruction.
And now I don't have suction.
Because if you're at like say 7 and you feel like a complete obstruction, you don't want to keep trying to force it down in there. Because if it's like a really big like chunky plug, you don't want to just like break that up and send it in the airway where you can just clean it. Okay. Also, depending on whether or not it's the appropriate trach size for your patient, you don't want to just keep pushing because if it's at a funky angle, it's not the appropriate trach size. Or say like some patients want you to go a little bit past that flow and you feel like a resistance, that could be tissue. And you don't want to cause any excessive trauma. And if there's already trauma for, say, someone else who did not care, you don't want to exacerbate it. Does that make sense? So if we ask you, like, what are other ways you know to stop sectioning your patient, at least be able to tell us that. Because that's a big issue where people will just keep pushing down.
What if there is an obstruction? Like, what do you do?
So, like, if, say, she was suctioning and she tries to go down and it stops at, like, 6, great part of, like, transitioning into, like, trach care after this is you would take your inner cannula and inspect it. Because a lot of times it could be, like, secretions that are caked on inside the tube or even, like, a plug.
And that will happen all the time, is that you'll open this up and just see, like, nastiness inside. So if it's a disposable inner cannula, that's great, you throw it away, get a new one. But if it's one of these, you're going to have to take the time to clean it out.
And if it's like you look and it's clean, but like you still have some form of obstruction, you don't really need to know this. But a lot of times, you want to check to make sure like your trach is at a good angle, as well as like depth. But you don't really need to know that, at least not for this part.
It's good to know for the So yeah, so now we'll say suctioning's done. He sounds great. He looks great. He's like, thank you so much for suctioning me. I couldn't breathe. Now it's time to do trach care because it's end of shift. I take off the sterile gloves I had on to suction, and I still have on my regular old gloves. Before I get all my clean trach stuff ready, I take out this gauze piece because even if it looks clean, once you take it out, this part right here is going to be real gross. This is trash, but now it's also going to be my clean gauze for later because I can't find the other split. So we want to leave on his trach ties. I like to leave on his trach ties for right now. I'm also, some people in this scenario, they want to start with taking out their inner cannula. Some people want to do that at the end. It's 100% whatever you're comfortable doing. It doesn't matter. The thing is that I want you to do it correctly. It doesn't matter what the order is. The order isn't correct. However you want to do it is correct, as long as you do the things right. Okay, does that make sense? Okay.
Okay, I'm gonna
So,
go ahead and demonstrate.
I just put on a new set of sterile gloves. Even though trach care isn't sterile, I want it to be as clean as possible because this is like an open hole to the inside of your body.
And you have to tell us, like, we're not gonna necessarily make you put on sterile gloves like twice or short twice, but you do have to tell us, like, from like suctioning, when you transition to doing trach care, you would put on a new set of gloves.
Right. Some people put on 2, 3, 4 sets of gloves whenever they do trach care, depending on the patient. So then I want to get all of my stuff ready. So this trach care kit, I have dry gauze, I have my brush, I have Q-tips, I have more gauze. So I take some water and I like to have 2 separate things. I have all my clean stuff here, I have all my dry stuff here. Dirty. I get this stuff wet, and then this is just an empty thing of water. This is what I like to do. It's also probably, I think it's just good practice. So I get my Q-tips, my wet Q-tips.
With this one, obviously you can tell there's no.
I like to do this part first. The only thing you need to know is the way I do it. Go from inside to outside. You don't want to go from outside to inside and push stuff inside. You're trying to pull stuff out. Does that make sense? So like if they had nastiness here, I'm not trying to push it into the stoma. I'm trying to like pull it away from the stoma.
And if, for the ones farther in the back, if you can't see, so she's not taking off the collar. You can, but you
No, like the,
So that they can see.
yeah. Probably still won't see it as much because like my hand, you're not going inside the stoma. It's more of like around the stoma. So when we say inside, we mean like you're kind of making that motion towards away from it. So it's like a near to far type deal. Okay. So whenever you're telling us about it, don't go inside the stoma.
I'm good. Yeah, I can start my sterile
Then after I do that part, I take my wet gauze, and if the outside of the flange is dirty, then I like to like wipe that down. Also working from closer to stoma to farther away.
I recommend putting on a size smaller
Okay. Then I get one for the skin as well, and like to go underneath the chin, underneath, still working from in to out, or closer to farther.
Putting on my sterile gloves over my nostril.
At this point, I'm going to take out my inner cannula. I'm going to go over to my thing of water, get it wet, and now this brush is made specifically for this. And I'm going to get it out. You might need to go around here. And now once I have done that, I'm going to put it in my clean water and like kind of give it a good rinse. Because you don't want to put it into the mucousy water, swish it around, and then put it back in. So I like to have like a nice clean one. Then dry. If you have dry gauze, if not, give it like a really, really good shake. But make sure that this isn't full of water whenever you go put it back in. Also, do not stick this in here. Okay? Common sense, you think, but you never know. Then start it at an angle and then push in. Don't force the inner cannula in, even though you know it's supposed to fit in there, because there is a chance that during all of that you might have coughed up a plug and now it's stuck in the outer cannula. And you could be hitting the outer cannula and you just don't know it, so never force anything. Now, take a good look. We're golden. If he's still wet there, dry, 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 dry.
Normally when you're in the room,
And now trach ties.
one, they're not gonna like,
So,
two, they're about to thrash when you start anti-sectioning them.
I like
It's gonna fall on the floor and you have
to
lean
go ahead and get
back
it
and do
ready
all over again.
and put it behind his neck,
Especially for NT. I know they say it.
just so I know that it's already there.
Especially NT because they're not gonna like it. You don't want your stuff actually anywhere near them. You see people set it
The
up
second
on
that I
back,
undo this,
I guarantee you, your water's gonna fall when they start thrashing.
my trach is like
For
no
NT,
longer
always have a separate
considered
spot with your stuff. And they will thrash.
connected, so you always should have one hand on. If the back of their neck needs to be cleaned, I do that at this time.
Someone's gonna have to hold those because
For now, I'm gonna go
They're gonna
over,
fight you.
don't do
Sucks.
this,
And don't lie to them. You go in
don't
and
do
say,
this, just
okay,
hold
I'm
it
gonna
to the
I'm gonna
flange
go ahead and
against
get
the
some
skin.
you. It's gonna suck.
Undid my gross
You're not
one,
gonna
now I'm
like
putting
it,
in my
but
not
it's
gross
something that I have to
one.
do so that way we don't have to intubate you. And they're gonna try to fight. Nope, I'm sorry, sir. I have to do it. You know, it's necessary. Unless you want to be
Two sets of
intubated.
trach ties here.
There's probably people out there that did not just put a tube down my throat because it's
Take off my old.
Anyways, this is also sterile.
Make sure that how many
And
fingers
you're
can
gonna have
fit.
to decide
Two.
which hand's gonna be
Make sure it's
clean
not
and
too
which
tight,
hand's
make sure it's not too
I'm
loose.
right-handed. I'm going to take my right hand to be my clean hand, okay?
Okay, I don't even
I'm gonna
understand
take
what
the
is
tip
happening
of
at
your
this
catheter
point.
This
and I'm
one,
going to wrap
it
it
came
in my
apart.
clean hand.
But you did good.
This is gonna be dirty. Right now, it's not.
Then,
this is gonna be dirty though. I'm gonna grab my
Split
suction
gauze,
line and I'm gonna
Mepilex,
connect it.
Dratex,
At
whatever it
this
is,
point,
goes
this hand is
underneath.
dirty. I can no longer touch my
Lay it
sterile
down
area.
flat.
When I'm ready to section,
What's that
I'm going
thing
to
called
unwrap.
again? The one
I'm
that you
gonna say,
just
okay,
taped around
Trach
the
tie.
I'm gonna
neck.
put it in my
Trach
loop,
tie?
Trach
and I'm
tie,
gonna
some people
start
call it trach holder.
feeding
It's
my
the-
catheter down my nasal passage. Now,
Then you put
the
this
anatomy
on.
of the passage just goes up.
And you want it to be like as flat as possible,
Put your catheter
without
in the
wrinkles,
passage
but this
of the way
freaking
the
gauze has just been through the
So when I
business.
hit resistance, I'm gonna go up
2 fingers fit,
and I'm gonna push back. So that way
Nice,
I'm
secure.
making it as comfortable as possible for the patient.
we're done.
Once
the
I
two
hit
fingers like
resistance,
this or
or once
like
I've stimulated a good cough, I'm gonna pull back a centimeter, and then I'm gonna start feeding my catheter
But yeah,
out. of my
Practice,
catheter.
it's really important to know how to put on sterile gloves, try not to
If I
break
hit